Well, I'll get started. Thank you everyone for joining today. We're going to chat a little bit about physician engagement, tools, things that we're doing at CHI Health, Creighton Common Spirit, hoping to keep it very engaging and questions and answers and how we can help each other. So I'm Dr. Vivekanandan. I'm one of the Infectious Disease Division Chief, Assistant Dean for Strategy and Accreditation at Creighton University School of Medicine. One of my passions is helping others and how we can create an inclusive, engaging culture. And we have Dr. Schooff here. He is a Director for Primary Care for CHI Health in Omaha. And his passion is also peer mentoring, well-being, wellness, and he's going to talk a little bit about commensality and how getting together with each other and spending time and getting to know each other creates well-being. And Sean Hansen on Zoom, as y'all can see, he is our director for hospital medicine for Midwest, so all 4 state market, and he has been with CHI Health for 30 years. And he is also very passionate about physician well-being and engagement. And both Sean and I have been doing a lot of work nationally at Common Spirit and bringing that back here and sharing experience and practices. Dr. Schooff, how long have you been with us now? 16 years, wonderful. And I've been with CHI Health Creighton. I started my fellowship at Creighton in 2011, and I've been here, I think, about 13 years or so. So all of us have long history with Creighton and CHI Health. So I'm going to focus on career development and how mentorship and has a significant impact on well-being. So why is that? Medicine is very stressful. We all just been through a pandemic, so that's even more stressful. And how can mentorship in medicine help us not be stressful? And some of the tools are when you have a great mentors, you get support, you get guidance, you get to have somebody to talk through the things that you're going through and get help that you need in that way. So when you have good mentorship in an organization, be it Creighton, be it CHI Health Common Spirit, you actually end up retaining your staff. You get to recruit high motivated individuals, and then you get to keep them happy and well-being focused. So here's a little article. We're evidence-based folks, so we like to look at studies. So this was published recently, how for mentorship, especially if you're a female, if you're a person of color, if you're from underrepresented background, of having mentorship is really important. And some of the things that's important is when you develop a mentorship program, it has to align with the institutional goal. The institution has to have resources because they have to sustain that effort. So we can't just start it and then stop. So it has to really sustaining effort, having resources and aligning with our goals, vision, mission, and values. And there's a big thing about having a mentor. Do they have to look like you? Do they have to have the same experience as you, background as you? It's nice to have that, but that's not needed. So studies show that mentees are happy when they have mentors from any backgrounds, as long as they have mentorship and guidance. So that's really important. And then the last thing is when you have mentors, we have to train the mentors for them to be effective to our mentees. So really, when we establish a good mentorship program, you have to have some of these basic principles. And we do have a program I'll talk to you all a little bit about, the CHI Health program for mentorship. So there's different types of mentorship as well. So, we think of in academic, the traditional mentorship, one-on-one, having a formal mentor that you meet every month, every other month, and making sure that they're able to invest in you and time. But in this day and age, you're very busy. Not a lot of people have time. And there's so much opportunity to mentor in different venues and different ways. So this is a really nice paper that showed effectiveness of mentoring in different models. So dyad mentor model is when you one-on-one mentor, right? Formal mentorship, one-on-one. learning from your mentor's experience and their guidance. How many of you have one-on-one mentorship models? Okay. So more opportunity for mentors. Peer mentorship is really crucial. So you could also have mentors who are in the same area as you are, same year of career. They have different experience who can guide you in different ways. So for me, I have lots of mentors who are peer mentors that I could go to. They have experienced certain things that they could share and help me, and I have helped them. So anybody here have peer mentors in a circle? So residents, do you all have peer mentors? Do you help each other? Residents, do you all have formal mentors? Yeah, wonderful. Facilitated peer mentorship. So I actually went through a facilitated peer mentorship model. So I was in a 1-year program at ELAM. It's for leadership for females in healthcare. And during that mentorship model, I had 6 female physicians from all over, same career level, mid-career like myself. But we had a facilitator mentor who was able to facilitate different discussions and how we could help each other. So that's a different type of model where you could have a group dynamic with the facilitator. Speed mentorship, just like speed dating, tonight we're having an event. If there's some mentors, you could ask lots of questions, get quick tips. So that's another way of doing things. Functional mentorship specifies on task. So let's say that pick a topic. So antimicrobial stewardship nationally, if somebody's doing well, I could email them and say, hey, you're leading this really well. Can you help me in this task? Is anybody right now looking to do any particular task that they want to do nationally or regionally that they don't have the mentors here? Adam, I'm just looking at you. So that's kind of like a distance mentorship model and functional mentorship model where task oriented, getting the guidance. So there's lots of different mentorship and group mentorship, of course, too, right? So you could have group of individual meeting together and mentoring each other, helping each other. So what does this all mean? Mentorship, support and guidance. And you could have it different ways. And how can we create that environment here? And we'll show some examples. Here's another study exploring the relationship between mentoring and doctors' health and well-being. Inherently, you all know medicine is very stressful, demanding, but mentorship program shows that it can help decrease stress, demand, help navigate. So some of the benefits is stress reduction. So you find out how to do certain things that you didn't know how to take care of. I have had so many mentors who have been able to help. I go to Dr. Pritza, for example, how do I build my ID division? I'm having struggles with certain areas, and he was able to mentor me into hiring certain things, certain practices. So I think it reduces stress. Then I know how to be effectively navigate through certain terrains. Increases confidence when you have a mentor, and if you know they're helping you, your internal confidence goes up. Of course, professional growth and development, support system, and improve communication skills. So a mentor really becomes dedicated to you and helps you in so many different ways. In this room itself, I have a mentee, and we meet every, just particularly she's in residence, and we meet whenever possible. But just looking at my mentee's growth gives me so much joy. And just looking at her grow in different areas gives me so much joy. And I know she probably feels the same way as well. So it's give and take when you're mentoring and you're helping them grow in so many different areas. And when I met my mentee HO1, and now I see her, I'm like, wow, you're amazing. Look at her go. So, and the trick is, if you meet anybody in medicine who has had mentors, their story will be like, I'm successful right now because I've had so many great support systems, including my own personal story. I have grown a lot but that didn't just happen. One day I woke up and I got to grow where I am. I have had so many mentors and throughout my career. So I'll share some of my struggles. I was an immigrant. I grew up in Sri Lanka, immigrant to Toronto. I didn't know anything about medicine, first generation in medicine. Didn't know, actually, I didn't even know when I got into residency, there's calls and, like a lot of things that I didn't know, had any clue. When I became an attending, new mom, I was the first physician to be hired in CHI Health in infectious disease. Before it was private practice, I had to build my own practice. I didn't know a lot of things. Husband is in the military, getting deployed. It was very stressful. I didn't know how to navigate myself or how to get things done. I was burnt out. I would say in 2016, I started in 2013, but in 2016, I was pretty burnt out because I didn't know how to navigate. And things that helped me a lot was we started having women in medicine and science meetings. So I met other females who are going through similar things. And I met one of my dear friends now. She was my mentor and coach. So I got a career coach, Lori Becky. And she kind of helped me navigate for 3 years and like really helped me build my practice. I was going to quit medicine. Or I was going to go into something different. I was going to move from Omaha. So, but having that mentors and that community really helped me change where I went. And I could share you, these are all my mentors and coaches and sponsors. So it's just not one person. When we talk about mentorship, people just think it's like one person, right? But it could be so many different people in so many different stages of life. Dr. Florescu, I have to point out, when I was doing Med Peds, I didn't know what direction I wanted to go. She took time and invested in me when I was a resident and told me ID would be an amazing path to go. And she just completely changed my trajectory of where I am today because she invested that time. Trainees, physicians, colleagues, they need mentors. And it was so impactful. But over the years, Lori, Marie, Joanne Porter, Dr. Johnson, when I entered ID, all the ID attending, Dr. Bittner, Dr. Horowitz, Preheim, Gorby, they just trusted me and they helped me grow. And they showed me a different way to do medicine. They were fantastic. So what I want to tell you is you don't have to have one mentor. You could have many mentors. And when you ask people to mentor you and help you, Dr. Dunley, Randy, everyone has helped me in so many different ways. And the pictures here reflect not just dyad mentorship, group mentorship. All these folks in here, these are all my peer mentors. She's nationally, Dr. Nancy Spector, nationally known, but all these folks are my peer mentors who has helped me when I need them, same stages in life. So it's really important that we think about mentorship differently and start making these connections and networks to help you grow. And also, like whenever I get email, can you help me? I always say yes. It fills my bucket. And I know if I ask Dr. Schooff, can you meet me for 20 minutes? He'll say yes. So it fills that bucket to help each other and share and help the next generation grow. So think of mentorship as more than just one person. They could help you in so many different ways. So here I am today, but my path to being a good clinician, professor, educator didn't just happen by myself. So many people helped me grow to where I am, and I still get so much help to grow to where I need to be. Quick data points for you all. So we started in CHI Health Common Spirit Health in 2021. New physician mentorship and new APP mentorship. Nikki Thomas, she's here, provider affairs, clinical transition strategist. She has been incredible in leading this effort. In 2021, she started this. She has had about 6 cohort of new physicians go through this. Heather Chambers, she's a market director for all the APPs, and she started a mentorship program for all the new APPs. She has had 13 cohort go through. So, and each mentee is actually at the end of this program assigned, or ideally will have a mentor so they could help them during this process. Some of the content covered during this mentorship program is a lot. Why is mentorship important? What is vision of mentorship? Strength finders. Talking about microaggression, diversity, equity, inclusion, work-life integration, why that is important with your realistic expectations, leadership alignment and leading this mission across the organization, addressing implicit bias, mentor-mentee matching process. I'm so incredibly thankful for the people that are leading this effort for new physicians and APPs because it's been phenomenal. Has anybody gone through this here? We all not new. And here are some of the faces of all the people going through the mentorship program. Dr. Sharma teaching physicians cohort. So where do we want to go? As an organization, we need to get to well-being 2.0, right? That means we have to now start focusing on not the way we used to be, hero-like qualities, work-life balance. We need to be work-life integration. We need to think about human qualities, vulnerability, growth, self-compassion, us, community, and meaning and purpose. So really thinking a different way than how healthcare used to be. And as an organization, CHI Health Common Spirit, we need to strive to go to action-focused, physician-administrator collaboration, leadership development, prevent distress, cultivate professional fulfillment or leadership workshop. So really, we need to help each other grow from where we used to be. And here are some of the programs we have at CHI Health Common Spirit Health. In 2017, we had conscious physician leadership. I was very fortunate to go through at CHI Health. I think there's some here. I think Mark Reisbig and I did this together. Yeah, Dr. Schooff, it was fantastic leadership tools for us to grow. We have Women in Medicine leadership course that just started recently. We have executive MBA, ELAM, so many venues that you all just need to learn. And of course, tonight we are having an event. Right now, we are having an event. These things are really important to continue to develop our leadership. Here are some beautiful pictures of all the different things. And this picture is from the recent Women in Medicine cohort and all the experience and how grateful they were for this experience. And all these physicians and APPs went through the program. And tonight, Dr. Wilson, our provost, will be talking about her leadership journey, and Julie Granetsky on strategies for career elevation. So these are opportunities for you all to meet mentors, network, and it's really important to take advantage of some of these opportunities we have. Here's data. So we like data, right? So looking at the data, physician turnover in 2021 was 12.2%. APPs were at 17.1%. With all this initiative, with so many people working, our turnover in April, physician turnover is 8.7% and APP 9.9%. Every time you lose a physician, it's close to $500,000 to $1.2 million. Every time we lose an APP, it can be close to $115,000. So imagine if you have 1,700 providers and we're having more than 10% turnover, the dollars that we're losing where we could invest in each other. And then here are some of the physician engagement scores. They are significantly better in our market compared to national common spirit market. So data shows it's working, but we have a lot more work to do. And I'm going to pass this on next to Dr. Schooff to talk about well-being. And we'll take questions at the end.
Thanks, Renuga. Give me a sec to play with the microphone. That should work. So as Renuga said, I'm Mike Schooff. I'm a family doc. Try again. Here we go. I'm a family doc, and I get the privilege of supporting and taking care of all of our primary care physicians and APPs, their clinic teams amongst CHI Health, mostly in the Omaha Council Bluffs Metro. I get to play a bit across the rest of the state, and then I get to collaborate with our internal medicine and our family medicine departments, and especially the residency programs, and how we help do that work together as well. And as part of that, then focusing on well-being, because that's how you take care of folks. Like Renuga, I've had actually, for me, several burnout experiences. and learned a lot of lessons in that I hope to share with others so they don't have to experience what I did. My disclosure is I am highly invested in you and your well-being, but I have no other conflicts of interest to report. So Renuga's talked about some mentoring and things like that, leadership growth. I'm going to talk about several things. Sean's going to talk about several more things. And I wanted to kind of set, so why do we talk about so many different things we can do for well-being? And I think about these people. Sometimes when people think about burnout or I need to prevent or protect myself from burnout, we think, well, I'm weak, I'm fragile, I'm broken already. And I think about these three people. Are they weak? Are they fragile? No. They work in very dangerous environments. They're brave, they're strong, but they know they need to protect themselves. Well, the same is true for you and me. We work in a very dangerous environment. The health system is broken and it can break us if we'll let it. That's why Renuga's talk about well-being 2.0 is so important, that we look systematically at improving the system. But that takes time and tons of money. One thing that you and I can do now is take care of ourselves while we're working on the environment. Also, we need to protect our whole selves. You wouldn't go to battle with just a helmet or just boots. You want your whole self protected. Same with well-being. We need multiple facets to protect all of us emotionally. And rarely does one size fit all. What works for Renuga, what works for Dr. Goodman may not work for me. So I need to try on various different techniques. Yoga for me is just an exercise in futility and sweat. It doesn't give me any resilience or strength. So that's not my method, but others love it and go for it. So as Renuga said, I wanted to talk about commensality groups, and it's a challenge as a speaker when the first thing you need to do is define what the heck you're talking about. So what is commensality groups? Well, commensality means the act of eating together or a group of people coming together to eat. And so commensality groups then are actually an evidence-proven, and we'll show that in a second, way to increase connection, collegiality, to build camaraderie and meaning in work by getting people together and having a meal. So we bring people together that have common experiences. I'm a physician, you're an APP, I work in the hospital, you work in the clinic, but we're still doing the same kinds of work. And as we do that and as we eat together, we can then support each other, and we can provide a safe space where we can talk about our concerns and our struggles and our challenges, and we can give each other tips and advice and some help along that way, some minor mentoring even in their group. So typically, as we look at commensality groups, groups of maybe 6 to 10 physicians and or APPs meeting monthly for several months, sharing a meal. And then as part of that meal time, we ask them to discuss a couple of topics related to work or work-life balance, just during their part of their regular conversation. It doesn't have to take the entire time, but just portion of it, talking about something related to work. So for example, we always give them some sample questions, but why did you go into medicine? Think about a meaningful encounter you had recently. What made it meaningful? Share a lesson that a patient taught you, or what have you learned from a mistake that you made in the past? What helps you meet your professional and personal priorities? And what helps you not bring work home too much? We'll talk later about the Mr. Rogers associated with that. And then again, self-care things. How do you manage stress? What role does forgiveness have in your life? Imagine sitting around a table with 6 or 8 other health professionals and talking about these sorts of things and the bonding and the ideas and the nurturing that can provide for you. So does it help? Sounds nice. I always like a free meal. Thank you for coming and joining some pizza with us today. We're commensalating together. But in controlled studies by people you've probably heard of before, Mayo, Stanford, those kind of folks, others, they've been shown to decrease the feelings of distress, to build camaraderie, collegiality, and a sense of community, to gain fresh perspectives and insights, to increase satisfaction, fulfillment, and meaning in work, to increase engagement and empowerment in work, and to improve emotional well-being and work-life balance. And you look at some of these, those are the key features of what leads to burnout, is when I feel that I have no power or control, when I'm not satisfied and fulfilled in my work. That's really where that moral distress just eats at us. And so if we can help with that, how much better our lives can be. Some references for those who want to see, is it really there? Is it just soft sciences? Some really good data there, various references to learn about what others are doing. So what about us here at CHI? Are we doing anything about commensality? The answer is, yeah, we're starting. Some parts of our larger organization, Common Spirit Health, have been doing this before, Tacoma and other places, and we've started to roll out something here locally where for our physicians and APPs in the Omaha Metro, we got a micro grant from a foundation with Common Spirit Health for 25 people to do this for 4 months. So in January, we send out some information about it through emails and through the medical directors. And within 2 weeks, we had 37 responses of people that were interested in doing this. They were from 20 different specialties. 60% were physicians, 40% were APPs. So we picked the first 25 based on how quickly they responded. And then we've organized them into 5 groups based upon when they wanted to meet. We said, do you want to meet for breakfast, for lunch, for a social hour, for dinner? And then they're just kind of mixed up from there across specialties, across degrees and functions otherwise. The groups met for their first time within this past month, basically. So they've had one gathering together. They'll meet monthly for 4 months. So we'll finish up roughly July or August. And then as some kind of mild data, without being too imposing upon them, we asked everybody to do the mini Z burnout inventory before the first group gathering, and we'll do that again after the 4th one, just to see what that might show as far as their experience with it. Then we'll obviously ask them also, did you like it, and tell us more about it and those sorts of things. So then what's the future of commensality groups? Well, here locally in the Midwest, based upon the feedback we get from those participants, based upon funding, unfortunately, is another concern. But we are going to hopefully look to expand the program for more physicians, more APPs in Omaha, beyond Omaha as well. But also anybody can do your own commensality groups. It can be something formal like a sit-down dinner. It could be snacks and a game. Again, the thing I can't give you is money for it, but I can give you support and encouragement to do it. It can be a group of friends. It can be a group of medical school or residency members. It can be partners in your clinic together. It can be multi-specialty groups or specialty partners. Anybody can get together. And again, especially when you share some commonality in your experience, then you can grow together through these experiences and have some fun eating and talking. So those are commensality groups. That's what we are doing, what we plan to do to help out. I know, again, lots of experiences like this in formal and informal ways. I know residents that, maybe use your journal club or something like this, for example, get together, have a meal, talk about some stuff, balance groups, lots of ways to do that things. Wanted to share while I had the audience just a couple of more tools and opportunities for you, some more pieces of your armor to support you in your fight against burnout and injury and stress and all that kind of fun stuff. For those in the CHI health world, here in our Midwest area, we have a provider website, and then one page off of that is provider wellness. And in this, you can see several categories. And if you go into those categories, there are presentations, mostly by me, that we've done about things related to wellness and fulfillment and burnout prevention. You can see several about the typical wellness things, stepping out of the whirlwind, the coming home boundary ritual. That's the Mr. Rogers, right? What did Mr. Rogers do when he came home every day? Took his shoes off, took his changed sweaters, sang "It's a Beautiful Day in the Neighborhood," right? And then he went from being outside Mr. Rogers to inside Mr. Rogers. And he was there fully present with us in his home in that day for that show. He wasn't distracted by what I got in the mail or whatever else. We can do that as we go home with a boundary ritual. The squeegee breath, to do kind of a mini boundary ritual every time you walk into an exam room or something else you need to do to clear your mind and be fully present. One of my favorites, treat yourself like a dog. I'm going to leave it at that. Hopefully spark some interest. Wish we had a way to count the clicks after this. Treat yourself like a dog. I ask you to do that. You'll be blessed. Some things about practice improvement and efficiency. Says again, part of our wellness is again protecting us, keeping us well, but part of it is also doing our job better or easier or more efficiently or less painfully. So we have several things about decreasing work after clinic, whacking the whack to do those things. So presentations there on the CHI provider well page, newly rebuilt with all the fun things about our computer internets. And then Common Spirit Health, again, our parent company has likewise a physician enterprise well-being and professional fulfillment webpage where they have some content about building community and belonging, building a peer support program, and also, again, care delivery efficiencies and effectiveness and best practices and those sort of things. So various things out there that you're access for all of us. So my invitation to you, as we meet today over lunch, as you're thinking about what do I need to do for the rest of today and tomorrow, my invitation to you is to spend some time over the next few days, for those who have access to the CHI websites and the Common School websites, look at those things that are out there. And for all of us to consider doing something to break bread with others that we share a little bit about, to be together and share things about. Do that on your own. And also when CHI is able to expand the offerings, hopefully this fall, sign up for doing those as well. The secret of getting ahead is getting started. And it doesn't have to be perfect the first time. So thank you. Have a great day. Have a great week. And my motto always is, please be well. And with that, we'll turn the time to Sean.
Thank you, Mike. Wow. I just want to say I'm feeling so grateful for my two colleagues, Renuga and Mike, and all of the work they do on well-being. I'll be talking about gratitude a little bit later on here and how powerful that is for your happiness and well-being. First, let's start with this quote from the Dalai Lama. And it's important because, as Renuga mentioned, medicine's a team sport. And one of my mentors has shared that with me long ago. If you're doing this alone, you're doing it wrong. Use mentorship programs, seek out help from others, build relationships from your peers with commensality groups, and then also work on your happiness actively. I'm going to spend a few moments talking about burnout and the recent research data that we know from Medscape Physician Survey. Could I have the next slide, please? Thank you very much. Okay, so this picture could represent a lot of things. Number one, burnout is a spectrum. Maybe this is just a snapshot of your day. You wake up, you're feeling like that fresh piece of bread, and then as your day goes on, maybe one or two things start knocking you down, you're getting a little toasty, but the difference with bread is that we have the ability to go backwards. We can reset and we can rebuild. Maybe this represents your career. We don't like to see it on the bottom where we're getting too toasty and even in a dark space. So today I'm going to bring forth some resources that are available for everyone nationwide and talk about self-care, cultivating relationships, and gratitude. Next slide is our most recent data from the Medscape Physician Lifestyle and Burnout Survey. What you can see here is compared to last year, reports of feeling burned out and depressed are both down. But that doesn't mean that our work is ready to stop. We can't rest on our laurels. We still have a lot of obstacles to overcome. Next slide talks a little bit about depression and suicide rates among medical students and US healthcare providers. So alarmingly, depression rates among medical residents range from 20 to 43%. Compare that to lifetime depression rates among physicians, 13% for men, 20% for women. And then we know that we have higher rates of depression in healthcare workers than in the general population. Next slide. September 17th is National Physician and APP Suicide Awareness. This is one day to bring forth this information, but it's not a one-day problem. These numbers are presumed to be grossly underreported. But annually, 300 to 400 physicians die by suicide, 30 to 31 nurse practitioners, and then physician's assistants. If you just think about this is the national average public school student body size. And so I want everyone just to stop and pause and think, hey, do you have a plan in place to seek help for yourself? Or if a colleague's in distress, what do you do? I'll share some resources with you coming up. Next slide. This information comes from a study that Dr. Tate Shandefeld did for many years at Stanford. He, in my opinion, is one of the country's leading experts on physician well-being. And he is quick to point out that when we're talking about burnout and depression, they're two different constructs and they have two different outcomes. We know that burnout leads to medical errors, depression can lead to suicide. These two can intertwine. As you have issues with burnout, you can be depressed and things can start to spiral. So what are we going to do about it? Next slide. Okay, we're all familiar with the flight attendant safety speech when we get on a plane to travel. So I'm going to put on my flight attendant hats and direct you to the exits. We're at the back of the plane and at the side. We always want to know where we can seek help. If I got to get out of this situation and seek help, what do I do? The most important thing with this image is they say, help yourself before you help others. Put your oxygen mask on, tighten the strap, and take care of yourself before you take care of someone else. So I ask you, how can we take care of others if we're not taking care of ourselves? You have to be open to receiving feedback from your peers. Maybe somebody else will recognize you're in distress. Maybe I'll see Renuga one day and I see her and I can see that she has that mask dangling above her, but she's not putting it on. We're close enough friends that I can reach out and say, hey, how's it going? How can I help? Please be open to receiving that help from your colleagues. Next slide. How do you do it? Throw up your bat signal. You need help, throw up the lifeline to seek help from your peers or professional resources. I want to spend a little bit of time on this next slide talking about the 988 Suicide and Crisis Lifeline. Next slide, please. Okay. We can all help prevent suicide. This is a 24/7 free and confidential support for people in distress. It offers prevention, crisis resources for you if you're in crisis, or if you see a friend or a colleague that's in crisis. Phone this up, ask for help on how you can navigate that. They offer best practices for professionals in the United States. There are options here. So when you dial this number, what's going to happen is you're going to have 3 prompts. Press 1 if you're a veteran and need veteran services. Press 2 for Spanish speaking services. And then option 3 is for LGBTQI+. You also can text that last option to 988, text Q to be connected to an affirming counselor. I would hope that we would not have to ever use this, but this is a valuable service that's available to everybody. And again, it does not necessarily mean if you are in distress yourself, but you have maybe a colleague, a friend, a family member who is needing some help, then you want to figure out how best to reach out. This service is free and confidential 24/7. The next slide talks a little bit about the National Physician Suicide Awareness Day, which is September 17th. And I will direct you to that using this QR code. It takes you to the Vital Signs website, which has numerous resources available to everybody. I've thoroughly gone through their website, and it's a fantastic source for research efforts and for resources for you to help a colleague out. And then next, another national resource that I know for a fact we have our Common Spirit Health psychiatrists volunteering for this. This is the physician support line. 1-888-409-0141. I would encourage you to put that in your phone. It's a free confidential service staffed by psychiatrists in the United States. They offer empathetic and active listening, motivational interviewing, supportive therapy, collaborative problem solving, and cognitive behavioral techniques to help you manage acute stress, panic, depression, issues with insomnia. They also will help you process stressors, existing mental health stressors. If you have substance abuse disorder, family dynamics, childhood issues, dealing with grief or loss, or dealing with chronic stress of just being a medical professional. So this is free, it's confidential, it's not formal treatment, and they don't report to anybody. It's another national resource that's available to you Monday through Friday. And I would advise you to go to this website and dig a little deeper if you have more questions. There's a lot of frequently asked questions on there with great explanations. Okay. Now, I want to spend the rest of my time talking about self-care, cultivating relationships, and then gratitude. Next slide, please. This is a very familiar screen to many of us. How many in the room, and Renuga, you'll have to help me, knows what your phone battery's at right now or what your watch battery's at? I would suspect the majority of us do. We know what our device batteries are at, but do you know what your own battery's at? How full is your tank? And what do you plan to do when your personal battery starts getting depleted? That's when self-care comes in. Have rituals in place and have friends you can go to make sure that you are taking care of your well-being and that your personal battery isn't getting down to 19%. We all know we want to let this happen to our phones. As our phone battery starts going down, we plug it into the car, or plug it in at our desk. We recharge our watch. But how do you recharge yourselves? Next
Sean,
slide.
I could ask how many
Yes.
people's batteries, yeah. Can I
Yeah.
get a hand of how many people's batteries are above 80% right now? Very nice. How many people's are about more than 50%? Personally. Yeah. Okay, let me rephrase that. How many people's batteries, personal batteries are above 80%? Okay, there's about 5, 6, 7. Okay.
Okay.
How many people's personal batteries are about 50% right now? About 5 or 6. How many are around more than 20%? How many people's personal batteries less than 20%? So Sean, I could tell you like handful of for all of them, and some are not participating at this moment. They're keeping it to themselves. But there's a variety of batteries, personal batteries right now.
Mm-hmm. As expected, as expected. And I hope that you all have ways to recharge your batteries, things you love to do, both outside of medicine and within medicine, with your patients, with your colleagues, how you can increase your battery level, increase your happiness. And so let's look at this next slide. Because one of the ways that I recharge is very common to most people. It's travel. Travel has so many benefits. First, planning your trip, anticipating the trip, going on the trip, and then having memories of that trip. But travel's not the only way to recharge yourself. We all know, maybe you like to go to the gym. Maybe you like to walk your dog every day. Maybe you want to spend time every day with a journal or reading your favorite book. I would just ask that you do it intentionally and make sure that you are spending as much time on your self-care as you are in your work. Like Dr. Vivekanandan talked about, work-life integration. Next slide is something that I recently changed in my own work life after going to a well-being conference. This is my out of office message. And so I would ask you, when you are away, be away. So every leader on this call, I would ask you to consider formatting your out of office message similar to mine. So first of all, I point out, I'm out of the office for vacation. This is my time. I'm working on my well-being and I will not be accessing emails. That's hard for people to do. And I can tell you personally, from having accessed emails during vacation, it can really ruin your vacation if it's some kind of a trauma coming your way. So please set boundaries. And when you are away, be away. Does anybody do this with their email sign off now? Or do you have the message of, I am out of the office. I'll get back to you, check my emails when I can.
Can I see a show of hands? There's about 5 people, 6 people that do that. And I think we might have about 50 people here.
Okay. Okay. All right. Another way personally that I practice the joyful practice of medicine and work on my well-being is I am a flower gardener and I like to do floral arrangements. I share some of these with my patients and that brings me joy and it also brings them joy. That practicing of gratitude, which we'll talk about in a little bit here, that's another way that you can work on yourself. And I share this personal story because making that connection with your peers, sharing personal things about yourself, expands everyone's joy and the joyful practice of medicine. So in summary from this topic, just remember your yes matters. When you're asked to take on different projects or do additional work, your yes matters. You have to also consider yourself and your self-care. So do it with intention. Okay, next slide. Talking a little bit more about cultivating relationships, like Dr. Schooff said, with commensality groups, and then mentoring, peer support. I want you to be the change and create the culture that you want to see. So next slide. This was a photo I took at Lakeside Hospital one day, and it just brought so much joy to my day. And you know what? We all are able to be change makers. You don't have to have a leadership title to make a change. You can do small things and big things with whatever position or role you have. I would say, just do it. You see something you want to have changed, be that change. As an example, the next slide shows how at my group at St. Elizabeth's, we've made it intentional that we celebrate everybody's birthday every year. Sometimes we got 2-3 birthdays in a day. And this is Hannah. She's one of our APPs at St. Elizabeth's, and we share a May birthday. So we've got the Aloha Friday cake going here, really living the Aloha spirit. And that brings a lot of joy to the group. And it's commensality, it's creating relationships with each other, building friendships. And again, we talk a little bit more about work-life integration. We all have to work, I'm assuming, to have that life that we want, but you can make these small changes within your own groups, within your friend circle, to celebrate each other. Okay. And getting towards the end here to wrap this up, the last thing I want to talk about is gratitude. So over the past 2 decades, there have been a growing body of evidence in the field of social science that has found that gratitude has measurable benefits for just about every area of our lives. It appears to contribute substantially to individual well-being and physical health. So much so that the Greater Good Science Center at the University of California in Berkeley, they're a leader in research on the science of social and emotional well-being. They describe gratitude as the social glue that is a key to building and nurturing strong relationships. This link here will take you to an article that talks about the benefits of gratitude. One study that they discuss involves about 300 individuals who were seeking counseling services at a university. One group of these individuals wrote a gratitude letter each week for 3 weeks. And then this group significantly reported better mental health compared to the control group at a follow-up of 12 weeks later. Another technique that is often used in gratitude is writing gratitude as a gratitude journal, sending thank you notes or notes of accomplishment to your peers, your friends, writing down 3 good things every day that's happened to you. Just reinforcing all of this behavior helps you feel happier. It deepens your resiliency. Next slide is something that I just started for our hospitalists throughout the division. I said, hey, you know what? I'd like everyone an opportunity to easily practice gratitude. So in our journey of the joyful practice of medicine, we created these posters that are hanging in the hospital medicine offices. They have thank you cards, easily accessible, so that if you come across anyone during your day, you want to send something in-house mail, we try to make it easy for you. Expressing this gratitude not only makes another person feel joyful, but also gives you joy and happiness. Okay. And lastly, I want to end by saying memento vivere, which is remember to live. Thank you all very much for your time today.
Thank you, Sean. We'll take some questions, but I do want to just quickly touch on gratitude. It's, I didn't believe in it when I first started. I didn't know the practice of gratitude. Father Clifton actually helped me learn about gratitude. I think Mark and we were in the conscious physician where he taught us, think every day one thing that you're grateful for, and think about every day one you think that you should have been grateful for, but you missed the opportunity to be grateful for. So on my phone, I think for the past 7 years, I have an alarm clock that goes at 6 p.m. And every day I say it's something I was very grateful for today and something I missed the opportunity to be thankful for. It just completely changes your brain chemistry, and you're always looking to be grateful for things. Things become glasses half full when you start doing that. So I think I know when I was a resident and fellow, you're just caught up in the day-to-day things of like seeing patients, doing things, but these things do matter. And I personally, it has really affected how I view things and how I see things. So it's really been very helpful, the practice of gratitude. With that, we would love to take questions. Any questions that you all have about mentorship, well-being when it comes to personal mental health, about commensality programs and data that we have shown that it works. Love to hear any questions, concerns.
I do have a question in the chat, Dr. V.
Yeah, go ahead. Can you read that to us?
Yes, I will read it to you. I believe this question is for Sean. It says, I love your signature line for vacation. I never do that because I always think I'm going to be more burned out when I come back if I don't take care of emails and work during my PTO. But then I read these from other people and I feel a little guilty. I feel a little jealous that they were brave enough to do it. Can you talk a little bit more about that?
Absolutely. And thank you for sharing that, because I felt the exact same way as you did. And that only contributed to worsening my burnout. This has been a journey for me. I didn't just start this and go cold turkey. I will tell you that for sure. Because I did wean myself off of checking the emails. But once you get to that space, you're going to find it to be transformative. And the more people that do it, that will create the culture that we want, that when we are away, we want to be away, because wellness is as important to us as any other aspect of the job that we are doing. Yeah.
This is Mike. I'll just add that we do know that. So if you take time off, you're going to come back. And if you're in an administrative leadership position, your email in baskets can be flooded. If you're a clinician, your EMR in baskets can be flooded. One of the people I've learned a lot about well-being from, Dr. Dyke Drummond, his advice from his multiple years of counseling burned out physicians is take a 2-week vacation, but come home on day 13 and day 14 from home. Work through your in basket and things like that. You'll actually spend less time doing work during your 2 weeks of vacation if you do it all in one day at the end than piecemeal all throughout those 2 weeks. And again, when you're away, you're fully away. Don't go into the office to do it, because then people will find you and say, hey, by the way, it's good to see you here, whatever. But from home, dig through those things, as opposed to then showing up that 14th day at work and seeing that you've got 600 emails, 500 phone calls, 6,000 MyChart messages, and whatever else fills you up. So plan for it, but yes, turn off.
Yeah.
One thing I also want to add is the email signature line. I always, in my email, I say, I'm emailing you at this time, but you don't have to email me when you're not working. So like, please email at your convenience when you are working hours. So I think that's important too, just giving others permission. Just because somebody sends your email at 8 p.m. doesn't mean you need to return it at 8 p.m. You can return it at 9 a.m. when you at work. So just, I think those practices are really important. Doesn't matter what level, having those so others understand that they have the space.
Gmail also has a feature of scheduled to send.
Yes.
So yes, if for my well-being, I'm doing something at 10 o'clock at night, I can then on an email, I can then schedule send. Yes, the first default is tomorrow at 8 a.m. and there's one tomorrow afternoon, and you can pick a date and time to do it. So then they don't even feel tempted. It doesn't ding on their phone or whatever. Or turn off your notifications. That's another good thought.
And I have seen people, oh, sorry, Renuga.
No, go ahead.
I have seen people put that in their email sign off, that if you would like this message to be sent to the top of my list, schedule it to arrive on the day I return from vacation.
Other questions? Oh, yes.
Hey, Dr. D, on top of mentoring, another old term that's thrown out is to be a coach. Do you find, is there any difference between being a coach?
Yeah, so the question I asked is there a difference between coach and mentor? And yes. So I actually, when I was going through my early on career burnout, I actually found a coach on my own. And coach usually work on finding solutions on your own. So they kind of help you to figure out how to navigate certain situations, how to help you find your own solution. So though they don't give you their solution, they help you find the way that you want to navigate. They kind of open the horizons for you and kind of make you see where you have opportunity. So coach and mentors are completely different, but a mentor can do both. But coaching is a little different technique. It's interesting that you asked that. Dr. Nahas and I were just talking about it today. And coaching is so beneficial. How to help each other navigate through certain circumstances. I had a coach for 3 years where they helped me work through, helped me learn about lots of different areas that I wanted to work on. Thank you.
And maybe one other thing about coaching while we're there is there are certainly career coaching and those sorts of things and personal life coaching. Also recognize that there are several physician specific well-being and burnout coaching services. So one group we didn't talk about today, Nebraska Medical Association has their Life Bridges program. Again, physicians, coaches that will work with you, talk you through what's going on with the stress and whatever in your life. Again, completely unreportable to anybody that if you involve in them. It's a completely anonymous program, completely free to physicians in Nebraska. And here at Common Spirit Health, we're probably a month away from opening up a peer coaching program, again, for somebody in distress, or when you notice somebody in distress and you don't feel comfortable approaching them, this peer coaching service will be available. Several of us have been trained to then reach out and say, how you doing, Joe? Can I help you? And working through all the stonewall that he'll throw up first.
I could give you an example yesterday where I was having a little bit of a rough day, and Dr. Lambert just asked me, how are you doing? How can I help you? I think it's so important that we ask of each other that, and I make it a practice. You know, I could tell when somebody's walking like this or their posture's down, you know, there's something going on, and there, you know, you could ask them, how are you doing? If you know them, you have that relationship. How can I help you? Because I think that could go a long way. So recognizing that and asking each other and having that peer support means a lot.
And don't take fine as an answer.
Yes, exactly. Just if you have that relationship, really asking how you could help. Just sometimes all you need is a listening ear and somebody to understand what you're going through and share that with you. Other questions? Well, I hope you all found this valuable. So mentorship is extremely important. Reach out to anyone. Peer mentors are important. We have so much commensality program. Get together with friends for pizza and a game. All the resources that we have at Common Spirit CHI Health Creighton. And tonight we have the Women in Medicine Symposium. Anybody is welcome. It's just sponsored through Women in Medicine, where Provost Wilson and Julie Grunetsky will be teaching us different tools. So thank you all for attending. Appreciate it.